I'm joined by the Health MEC in the province, Nomagugu Simelane-Zulu. Good evening and thank you so much for your time. Is KwaZulu-Natal ready for a rapid influx of COVID-19 cases?
Good evening, Sally, and good evening to your viewers at home. Sally, as you would know, we're the first province that received the first case, and I think we received the first 10 cases. So we have been working on preparing ourselves for quite some time now. Of course, the initial projections were speaking to KZN having had more than 300,000 infections around this time. And we are nowhere near there. But these projections, Sally, I believe that they really helped us because they made sure that we did not sleep and we worked very hard. So in preparation for the peak, Sally, we made sure that we repurposed some of our hospitals. The beds in our hospitals. We have created field hospitals within the province. We had to make sure that we get human resources because historically we've had challenges in the province of being short-staffed. So in preparation for the peak, we had to make sure that we get we get staff. Of course, it's not to the level that we would have liked to get, but because of financial constraints, we were able to make do with what we have. Of course, we had to get PPE, we had to get equipment. Right now, a challenge that we still have is in relation to ventilators, but we are talking about ventilators that we have ordered, but we do have ventilators that we have in our facilities and that we are utilizing, and we are having discussions on how are we going to go around that should we then have that particular problem. We've ordered CPAP and all of that. So in essence, I'm saying we believe we are as ready as we can be. Because, of course, no one really expects, or you are never ready when the peak gets there, but we are ready.
That is so very true. And I was wondering what's happening at the moment. I just want to run through a couple of figures with you. How many COVID or suspected COVID patients are in hospitals, public and private, in KwaZulu-Natal this evening?
Well, currently in hospital we have 1,415 patients in the private sector, and we have about 360 in the public sector. So that's 80% in private and 20% in the public sector. I'm glad that you've asked me this question, Sally, because it gives me an opportunity to also speak to our patients and clarify a misconception that seems to be out there, where people don't really want to come to hospitals and come to our facilities, probably because of a stigma that might be there that is associated with both the virus and also with some of our facilities. I do want to put it out there and assure the community of KwaZulu-Natal that we have repurposed our facilities, and those that have been in some of them and that have been admitted will tell you that actually we are now looking at facilities that are quite new and are at a level that can treat our patients. So we are calling on our people to actually come forward. Should you not have you should not have a space to self-isolate, we've got more than enough space in our facilities for now to isolate people.
That's really great to hear. How about your ICU capacity? How many people in ICU with COVID at the moment in KwaZulu-Natal, and how many beds have you got available? How many have you got left for them?
Well, currently we have quite a few beds. We have 16,401 beds, Sally, in KwaZulu-Natal. Of the 16,000 beds, more than 3,000 are your isolation. And we decided that instead of building more quarantine sites, we should be able to hire buildings that we could utilize, including your hotels, your B&Bs, and so forth. And out of those, we've got 11,833 beds that we can utilize. But we also have 1,162 quarantine sites within our own facilities. So we believe that for now we've got enough beds, and we don't think people should shy away from coming to our facilities, because this is where they actually are going to get the assistance that they need. Now that is just
MEC, I just need to cut in. You've made your point really well about the beds. Very quickly, the ICU beds are always the worry. How many people in ICU with COVID in KwaZulu-Natal at the moment?
Currently, we've got 190 ICU beds, and we have 62 ICU beds that we are working on. Remember, the beds that I'm speaking to are just beds that are in the public facilities, not even the private sector, because we've not spoken to those. So we really are not overwhelmed at the moment, and that's why we are calling on people to avail themselves. I mean, when people get sick, they should come to our facilities because we have space and they should be able to be treated. On ICU right now, we've got 57 in the public sector, and we've got of the 57, we have 44 of them that are ventilated, and 14 of them are on oxygen. So you know, when you look at that and you look at our numbers, you can see that we still have enough space. By the way, the ICU beds that I'm giving you, Sally, are just ICU beds that we have put aside for COVID-19. This is not the total number of the ICU beds that we have in the province, because we are very much aware that there will continue to be other sicknesses that are out there, that people that might need those spaces. So the 192 that I'm talking to and 252 in total is just for those that we have put aside for COVID. But should the need be arise, we will then be able to increase those numbers.
Thank you so much. It sounds like a very comprehensive plan, and we wish you all the best as your numbers increase. KwaZulu-Natal Health MEC Nomagugu Simelane-Zulu giving us all the information on their preparation.